So it's quite helpful to distinguish between early stage and late stage prostate cancer. And that's because if cancer is diagnosed early enough, there's a pretty good chance that you can remove the entire tumour and cure the patient. However, if some of the cancer cells have spread away from the prostate, it's very hard clinically even to locate these cells, let alone to remove them. So these patients are treated with drugs that selectively kill cancer cells. Now, unfortunately, the problem with this is that cancer cells are very smart. They're constantly evolving and adapting to their environment. And what this means is that many cancer cells will eventually become resistant to practically any drug used to treat them. This is a major clinical problem in the management of cancer, and it's a significant area of research interest. So our laboratory is interested in trying to understand how prostate cancer cells become resistant to therapy. And some of our recent work has led us to focus on one particular protein. And cancer cells make a lot of this protein at about the same time as they start to develop resistance. So we were fortunate to collaborate with a pharmaceutical company that had developed a drug that can block this particular protein, and they gave us lots and lots of drug to test in the lab. And we tested it across different stages of prostate cancer. And remarkably, what we found was that by far the best results that we were seeing was in advanced stage disease. And that's actually very unusual because most drugs are more active in the early stage of disease where cancer is less aggressive. So we were very encouraged by these results, and we were seeing a delay in development of resistance, and we could, with this drug, increase survival time by almost threefold. So we're really thrilled with these results, and we're excited to take this into a more clinical setting. So just on a hopeful note, about 30 years ago, if you looked at all men who had been diagnosed with prostate cancer, their 5-year survival rate was about 60%. And today that's 95%. So that's a really encouraging and remarkable improvement in patient outcome. And that's been the result of research, which has been funded by funding partners. So we're incredibly grateful to funding partners like Marianna.
It's really important to get diagnosed early, so make a date with your GP and get your PSA checked, because that could make your diagnosis come sooner, which will prevent treatments and late stage disease, which is the hardest hitting part of prostate cancer. So an early diagnosis is key. So get your PSA checked today.